Hello. Today is October 8th, 2023. My name is Terry Woodman, and I recently returned 4 days ago from Mexico, where I had the privilege of undergoing HoLEP surgery performed by Dr. Hugo de la Rosa in Guadalajara. I am eager to share my testimonial about this life-changing experience. On August 13th, 2023, my life took an unexpected turn when I lost the ability to urinate due to an enlarged prostate. Up until that point, I enjoyed robust health as a nearly 70-year-old individual. Immediately, I rushed to Rocky View Hospital's emergency department in Calgary, Alberta, which is renowned for its urological expertise. Despite numerous attempts by dedicated nurses to insert a catheter, they were unable to succeed. After hours of discomfort with a full bladder, a urologist intervened. Even he struggled initially, but he persevered and used a wired method to successfully insert the catheter. From conversations with him at this time, I learned that TURP operation wouldn't suffice, and only HoLEP would provide a solution. However, the waiting list for HoLEP surgery was over a year. I was prescribed Flomax, which would take 2 to 4 weeks to show results, and Tiva dutasteride, which would take approximately 4 months. The urologist agreed in having the catheter removed after 2 weeks to assess my progress. Unfortunately, after 48 hours without the catheter, my symptoms returned. I spent a nerve-wracking night in the emergency department as there were no urologists on duty overnight. Nurses monitored me for signs of kidney issues and administered opioids to ease the discomfort. Another urologist, not the first one I seen 2 weeks prior, arrived in the morning, reviewed my file, and successfully reinserted a catheter using the wire method. This took him approximately 5 minutes with the wire method, but he did try the normal procedure beforehand. In early September, I received a phone call from the initial urologist recommending a suprapubic catheterization procedure be done when catheter is due to be changed after 4 weeks of use. He mentioned he is not willing to insert catheter through the urethra as this traditional catheterization proved difficult and time-consuming. I inquired about early catheter removal after 4 weeks on the Flomax, but was informed that my chances of urinating without a catheter were 0%, and I would have to wait for HoLEP surgery, which was more than a year away. The situation left me with several questions and alarming concerns. Why was I taking medications to improve urination when I will not be given a chance to see if they can work? Why did the urologist keep me on these medications while indicating that I would have to wait for surgery? Catheterization, which should be a temporary solution, became a prolonged ordeal. The fact that only one urologist in Alberta can perform the HoLEP surgery exposes the flaws in our healthcare system. The situation took a toll on my mental well-being, led to muscle atrophy, the elimination of a good night's sleep, and limiting my daily activities. I am down to an old man's painful shuffle walk. Being catheterized is simply very nasty, infectious, limiting your life expectancy, and very disabling. Facing these challenges, I knew I needed to explore other options. After hours of internet searching with my son, I chose Dr. Hugo de la Rosa through Pulse Protocol, a decision I would later realize was the best I could have ever made. As I learned more about Dr. Hugo, my confidence grew, greatly improving my mental state. A virtual meeting with him was arranged through Pulse Protocol, and after Dr. Hugo reviewing my medical records, he scheduled me for the HoLEP procedure in a couple of weeks for September 29th. During my time in Guadalajara, Dr. Daniel from Go Health took exceptional care of me, handling all transportation, accommodation, and necessary medical tests such as x-rays, abdominal ultrasound, exercise program for pelvic floor, blood work, nutrition before and after procedure, and all his positive help in ensuring my well-being. I'm very thankful in having Dr. Daniel along this journey and being well prepared for my procedure the next day. His support was invaluable in this preparation. The complete package with Dr. Hugo using Go Health was simply amazing, exceeding expectations. The entire experience I received with such genuine care and expertise made this healthcare journey a pleasant one. Despite initial skepticism from some in Canada about seeking medical treatment in Mexico, I can confidently say that this was the ultimate choice. My surgery was a complete success, and I am now on the path to recovery. If anyone reading this testimonial is considering the HoLEP procedure, please feel free to reach out to me at 403-797-0837 to discuss your thoughts and concerns. I believe I'm one of only a few Canadians who have undergone this procedure in Mexico. I am here to provide information and support. You may bypass me and Pulse Protocol and contact Dr. Daniel from Go Health to arrange your journey in having your health and well-being restored. I extend my heartfelt gratitude to Dr. Hugo de la Rosa for his exceptional care and expertise in restoring my health and well-being. Thank you.